We are called upon the next speaker of the day, Dr. Purnoor Siraj. Dr. Purnoor Siraj is going to present on a keynote about the dietary management, improving public health and awareness of overdose, immunity booster food during pandemic. About a short note of Dr. Purnoor Siraj, in 2006, Dr. Purnoor Siraj received her MSc from Isabella Thorbone College, Lucknow University, India, and her PhD was awarded in 2013 from King George Medical University. Presently, she is working as a deputy director at Disney, Lucknow. She has more than 9 years of teaching experience at UG and PG level. She worked with various national and international organizations like NICCD, NIN, WHO as a researcher and has more than 3 years of research experience. She has actively participated in various national and international seminars, webinars, workshops, and conferences. She has presented a lot of oral and poster and oral papers in various national and international conferences and was won Best Paper Award. She has filled 1 patent and a lifetime member of IDA and HSCAI. Today, she is going to present a topic about dietary management, improving public health and awareness of overdose, immunity booster food during pandemic. Dr. Purnoor Siraj, welcome you, ma'am, for the 8th TWCS. Please. You can share your screen and you can proceed, ma'am.
Thank you so much for your kind words. Good morning, everyone. I'm Dr. Purnoor Siraj from DS Institute of Naturopathy and Yoga. And today I'm here to present can I share this? The University of America for giving me opportunity to talk about such a hot topic today. And it is, as you can see on a screen, my topic for the today's talk is dietary management, improving public health and awareness of overdose immunity booster food during pandemic. As we all know, in December 2019, there was an outbreak of pneumonia of unknown cause in Wuhan, China, which affected more than 60 people on 20th of that month. And on 31st of December, the Wuhan Municipal Health Committee informed the WHO that 27 people had been diagnosed with pneumonia of unknown cause, being 7 of them critically ill. By January, the first case of coronavirus disease has been reported outside the China, 2 in Thailand and 1 in Japan. Then the rapid spread of the disease prompted the WHO to declare it as a health emergency of internal infrastructure. By that date, the disease has been detected in all provinces of mainland of China. Cases were also diagnosed in 15 other countries. In March, the disease was already in more than 100 territories worldwide and recognized as pandemic by the WHO. At the present, the number of confirmed cases continue to grow. The COVID-19 patient can develop disease in different forms. They can be asymptomatic, have mild symptoms, or they can also have severe symptoms that can lead to hospitalization and in severe case death. The most serious clinical conditions are characterized by acute respiratory distress syndrome, cardiac insufficiency, and septic shock. And these cause tissue damage in alveolar level, generating pathological tissue alterations, hyperplasia, and infiltration. So, unfortunately, to date, no specific treatment has been found for the cure of this virus, and therefore it is advisable to implement all possible strategies in order to prevent infection. Due to novelty of this pandemic, scientific community is currently looking for effective vaccine as well as drug to treat the pathology. One of the biggest challenges is focus on the reducing inflammation without compromising the correct immune response of the patient. In this scenario, science should focus not only on its effective drugs, but also in nutrition. Nutritional influence on the immune system has been well documented in literature. In general, where practicable, an effective way to reduce the risk of viral infection is to regulate the action of inflammation mediated through adaptable risk factors such as diet, exercise, and healthy lifestyle. Adopting a consistent long-term dietary pattern is the only way to benefit human health. On the contrary to this, the adoption of unhealthy lifestyle, that is worsening the diet regime and the reducing physical activity, is associated with high level of oxidative stress, which could lead to development of non-communicable disease. Admittedly, it is well described that the diet regime strongly influences the immunity system responses. Some reports says that uh, high BMI or excessive adiposity may be risk factor for complications during COVID-19 infection. This may be caused by the presence of different pulmonary diseases in obese and overweight population as compared to the healthy weight subject. Moreover, obese patient may be considered at greater risk of development of COVID-19 disease for the presence of other comorbidities that could impair their heart or pulmonary function, just like non-obese subject with those risk factors. For these response, particularly in this pandemic period, it is important to maintain our weight and body composition in line with international recommendation for stature and sex. So considering this particular scenario, here I'm addressing several important aspects related to diet and COVID-19 infection in order to highlight the importance of diet and supplementation in prevention and management of as well as recovery from COVID-19. The role of nutrition in management of COVID-19. The influence of nutrition in the immune system has been widely reported, and numerous scientific studies show that adequate nutrition is required for all cells, including those of immune system, to function at their best. So here we need first increased energy demand as activated immune system additionally enhances energy demands during the COVID infection with an increased basal metabolic rate. Therefore, optimized nutrition for the best immune outcomes would be one that support immune system additionally enhance energy demand during COVID infection with an increased BMR. Therefore, optimized nutrition for the best immune outcomes would be one that supports immune cells function by allowing them to engage robust responses to pathogen, but also to improve the responsiveness with appropriate avoiding any underlying chronic inflammations. Enhanced protein requirement. Protein deficiency is linked to impaired immune system function, mainly due to its negative effect on both the amount of functional immunoglobulins and gut-associated lymphoid tissues. Besides quantity, the quality of protein is also an important factor with regard to the relationship with this macronutrient with immune system. So include protein of high biological value that those present in egg, lean meat, fish, and dairy products. Containing all the essential amino acids may exert an anti-inflammatory effect. In addition, some amino acids such as arginine and glutamine are well known for their ability to modulate the immune system. The next is good quality food fat supplementation. The lipids, omega-3 fatty acid, EPA, and DHA can inactivate and envelop viruses by modulating the optimal host lipid conditions for viral replication. On the other hand, EPA and DHA inhibit cyclooxygenesis enzyme and thus may help suppressing prostaglandin production. Moreover, there are enzymatically converted to pro-resolving mediators such as protactins, resolvins, and myricins, alleviating inflammation. According to these effects, the supplementation with DHA and EPA may be useful to reduce the severity and improve the recovery of patients from COVID-19. On the other hand, polar lipids such as phospholipids, glycolipids, and sphingolipids that are also present in the source of omega-3 fatty acid food sources have the ability to block platelets activator factor as well as its receptor, exerting anti-inflammatory effects that may be beneficial in COVID-19. Moreover, these lipid species can also downregulate the enzymes involved in PFA biosynthesis as well as regulate those involved in the degradation. The blockage of platelet activation may also be useful to prevent the thrombotic complication associated with COVID-19. Next is carbohydrates. So carbohydrates and dietary fiber both have have also been reported to relate the immune system function. As far as carbohydrate is concerned, the consumption of those with higher glycemic index can result in mitochondrial overload and subsequent free radical synthesis. Indeed, increased circulating levels of inflammatory cytokines such as C-reactive protein, tumor necrosis factor alpha, and the interleukin 6 have been reported with the consumption of these kind of carbohydrate. Due to the inflammatory status that usually occurs in respiratory infections such as COVID-19, limiting the consumption of food rich in these carbohydrates may be advisable. Adequate amount of fiber is the next thing. With regard to fiber, it is important for correct metabolic functioning has been widely reported. Several studies have revealed that an adequate fiber intake that is around 25 to 35 grams per day may help to reducing both systemic and gut inflammation. Indeed, the consumption of food that are source of fiber has been related to lower level of inflammatory cytokines as well as enhance the level of short chain fatty acids. So it has direct inflammatory effect by inhibiting the release of pro-inflammatory molecules and by decreasing the expression of nuclear factor. Moreover, short chain fatty acids also play an important role in maintenance of the adequate gut microbiota by increasing the diversity as well as enhancing the presence of specific health associated bacteria. Besides gut microbiota, nasopharyngeal microbiota may also be involved in respiratory infection. Indeed, it has been reported that this kind of infections may result in altered gut microbiota and innate immune system response. Taking into account that COVID-19 has been related to respiratory and gastrointestinal system, it seems possible that gut microbiota impairment may occur, which in turn can result in enhanced inflammatory status. There are the effect of several nutrients on immune system function and other important aspects on COVID-19 infections such as oxidative stress, inflammation, and thrombosis. As you can see in the figure, the protein of high biological value, omega-3 fatty acid, vitamin A, vitamin C, dietary fiber, and selenium, copper have anti-inflammatory effect on coronavirus because whereas vitamin A, C, and D have protection against respiratory infection. Omega-3 fatty acid, vitamin A, vitamin C, and vitamin E have antioxidant effect, and polar lipids have anti-thrombotic effects, whereas vitamin E, iron, and zinc increase the immune function. So the disease severity decreases and enhance the recovery or clinical outcome and decrease the hospital stay. Here we can see different nutrients, their key role in disease with immune function and their recommended dietary allowances for healthy individual and disease infected patients. As we can see, vitamin E, I just want to give a little brief about it. Vitamin A, vitamin C, vitamin D, vitamin E, vitamin B6, vitamin B12, and folate, iron, magnesium, and trace elements including zinc, selenium, and copper play a pivotal role in disease susceptibility and the maintenance of immune function. Deficiencies and their inadequate status in these nutrients may negatively affect the immune system, resulting in decreased resistance against infection. The mentioned vitamin and mineral are essential for adaptive immunity as they are involved in cytokine production, lymphocyte differentiation and proliferation, antibody production and generation of memory cells. Regarding to innate immunity, they also contribute to the maintenance and development of physical barrier and differentiation of innate cells, production and activity of antimicrobial proteins, phagocytic activities of neutrophils and macrophages, and regulation of the overall inflammatory responses. The relationship between vitamin A and the infection has been extensively described. In the case of respiratory infection, vitamin A play a pivotal role due to its involvement in healthy mucus layer formation as well as enhancing antigen non-specific immune response. In these, histopathological alterations have been described in pulmonary epithelium and parenchyma in subjects with vitamin A deficiency, resulting in impaired respiratory function. Consequently, adequate intake of these vitamins should be guaranteed in order to avoid the further complication in case of COVID-19. So here we start with vitamin, the immune function and maintenance of functional and structural integrity of mucosal cell in the innate barriers, normal functioning of T cells, antimicrobial, anti-inflammatory, and antioxidant effects, antibody production, reduction of respiratory tract, and lung infection risk. A healthy individual can take up to 200 milligram per day, whereas the diseased person can take 1 to 2 gram per day of vitamin C. Whereas vitamin D, as far as vitamin D is concerned, the association of vitamin D deficiency and respiratory tract infection, the lung injury has been widely reported. Indeed, the usage of vitamin D has shown effectiveness on these conditions. Furthermore, previous investigation also demonstrate that the high doses of supplementation of vitamin D, that is 250,000 international unit to 5 lakh international unit per day, is safe and effective in improving the healthy status of mechanically ventilator in critically ill patients, which results in shorter the hospital stay. So here the immune function of vitamin D is maintenance of functional and structural integrity of mucosal cell in innate barriers, normal functioning of T cell, antimicrobial, anti-inflammatory, and antioxidant effect, antibody production and antigen response, reduction of maintenance of functional and structural integrity of mucosal cells in innate barrier, normal functioning of T cells, antimicrobial, anti-inflammatory, and antioxidant effects, antibody production and antigen responses, reduction of respiratory tract and lungs infection risk, alleviation of inflammatory response, and the recommended dietary allowances for vitamin D is 2000 international unit, and which is increased during the disease or infected person, that is 10,000 international unit during few weeks, followed by the 5,000 international unit. Vitamin E has been related to the correct function of hormonal and innate immune function. Indeed, the ability of vitamin E to scavenge reaction oxygen species plays an important role in oxidative stress reduction, exerting anti-inflammatory effects. In addition, vitamin E also protects polyunsaturated pupa and immune cells from oxidation. Immune function of vitamin E are maintenance of functional and structural integrity of mucosal cell in innate barriers, differentiation and functioning of innate immune cells, inflammatory and antioxidant effects, antibody production and antigen responses, reduction of respiratory tract and lung infection risk, support of T cell mediated immunity. The requirement for vitamin E is 50 milligram per day as per the RDA, but it should be increased to up to 200 international unit per day. Omega-3 fatty acid, which include EPA and DHA. The immune function of these are conversion of specialized pro-resolving mediators such as protecting and resolving the medicines to relieve the inflammation and enhance lung injury. The recommended allowances are 250 to 300 milligram per day, whereas a diseased person can take up to 1,500 to 300 milligram per day. Selenium. Selenium also play an essential role in immune system due to its anti-inflammatory effect. This effect is in line with significant benefits of selenium supplementation demonstrate against other viral infections, including HIV, hepatitis B, linked liver cancer, or epidemic hemorrhagic fever. Here, the immune function of selenium are differentiation and functioning of innate immune cells, normal functioning of T cells, antibody production, antimicrobial and anti-inflammatory and antioxidant effect. The RDA for the healthy person, it should be 50 milligram per day, and for diseased person, it should be increased to 200 milligram per day. So, with regard to zinc, zinc iron concentration inhibits the replication of coronavirus. On the other hand, zinc deficiency is linked with defective cell-mediated immune response as well as with increased susceptibility for various infections. Indeed, it has been suggested that increased zinc intake may exert beneficial effects on COVID-19 infections by reducing gastrointestinal and lower the respiratory symptoms. In addition, it has been suggested that zinc intake of 30 to 50 milligram per day may be exert beneficial effect on RNA of viruses. So the immune function of zinc are maintenance of functional and structural integrity of mucosal cells, innate barriers, differentiation and functional of innate immune cell, antimicrobial, anti-inflammatory and antioxidant effect, antibody production, antigen response, support of lymphocyte and cytokine functions, and innate immunity overall. Within 24 hours, and that should be divided into 6 to 8 doses, each separate by 2-3 hours when away. Zinc glutamate at 13.3 milligram per day within 3 days at least. Iron. Iron is a nutrient with diverse implication in COVID-19. On the one hand, it is well known the importance of iron for the correct functioning of immune system. However, it is also well established that iron containing enzymes are essential for completing of virus replication process, particularly coronavirus. The immune function of iron are maintenance of functional and structural integrity of mucosal cell in innate barriers, differentiation and functioning of innate immune cell, normal functioning of T cells, antimicrobial, anti-inflammatory, oxidant. A healthy man can take up to 8 milligram per day, women aged between 19 to 50, 80 milligram per day, and women more than the 51 can take 8 milligram per day, whereas the diseased person can take ferrous iron salt 60 milligram iron per day, and it should be taken with food to avoid gastric discomfort. As far as multivitamin supplementation along with multiminerals, because we all know multivitamin and multiminerals have protective and regulatory function. Here are some immune function, the support of cells and tissues of immune system, overall maintenance and development of innate barriers, growth and differentiation of innate cells, antibody production and generation of memory cell, production and activity of antimicrobial proteins, phagocytic activities of neutrophils and macrophages, supplying of nutrient requirement according to 100% RDA for age and gender, that this is an additional to a well-balanced diet. Recommendations for nutritional treatment. So, in general, recommendation for COVID-19 patients is to follow healthy diet to maintain a correct immune function, optimal intake of all nutrients, only those that play crucial role in immune system, should be assured through a diverse and well-balanced diet. That there is a prevalent micronutrient and omega-3 fatty acid deficiency in several population groups found in various studies. In order to promote the optimal functioning of the immune system and to reduce the risk and consequences of infections, the intake for some micronutrients may exceed the recommended dietary allowances. Since infections and other stressors can reduce micronutrient status, the supplement may help restoring their normal blood level. With regard to supplementation, it is important to advise the general public to always consult a medical doctor prior to consuming such products, as they can interact with other nutrient, drugs, and medical treatment. Indeed, they can turn into toxic elements, causing several disorders and aggravating certain conditions. So the nutritional therapy in non-clinically ill hospitalized COVID-19 patient, as far as the macronutrient concerned, nutritional management strategies adopt for less ill patient because it is low palatability of the hospital meals, make the energy and protein intake low, which can lead to the bad nutritional status of patient. In this scenario, the orally feedable patients of COVID-19 receive a personalized meal provision, which is completed with oral nutritional supplement in order to meet the energy and protein requirement. In the case of patients who are unable to eat, enteral and parenteral nutrition formulas rich in protein and poor in glucose are provided. Based on the knowledge acquired by the different studies while working with patients who were recovering from COVID-19, a three-step nutritional protocol has been designed. The first step of this protocol would be focused on the nutritional assessment and malnutrition screening of the patient. For this purpose, different anthropometric parameters as well as the body composition of the patient are studied. Further, the weight loss is monitored and the different blood tests, including the blood count, protein soluble capacity of the patient, should also be considered. Finally, after evaluating the nutritional status of the patients, second step devoted the setting the nutritional treatment of the patient take place. In this regard, the management of computerized system of the hospital. In this scenario, energy requirement are calculated using the predictive equations which are adapted to the nutritional status of the patients according to their clinical status, physical activity, and stress condition. So here, as far as the macronutrients are concerned, energy should be given according to the stress level of the patient, and the protein should be given from more than 1 gram per kg body weight. It should be increased from 1 to 1.3 gram per kg body weight, but it should be advisable to give 1.5 gram of protein per kg body weight per day. So the carbohydrate and fat, here is a mistake, that fat and carbohydrate ratio, that fat should be 30% and carbohydrate should be 70% with the patient with respiratory insufficiency and 50% with respiratory insufficiency. And the micronutrient including the vitamins, minerals, and trace element in water, it should be given according to the RDA. And the next is nutritional therapy in critically ill hospitalized COVID-19 patient. Some COVID-19 patients experience several respiratory symptoms and multi-organ failure, being very ill at hospital admission and thus needing specialized support. Indeed, acute respiratory complication requiring prolonged ICU stays are a major cause of morbidity and mortality in COVID-19 patients. Most of these patients rapidly progress from the cough and then to respiratory failure requiring mechanical ventilations. Consequently, the timing of nutritional intervention appears to be critical. Therefore, the nutritionist should choose the most appropriate way to recover the subject's health. As with other critically ill patient, nutritional management is an integral component of good supportive care. The European Society of Clinical Nutrition SPEN has recently published some guidelines for nutritional management of patient of COVID-19 infection. In these guidelines, specific recommendations are included for patient hospitalized in ICUs. Among them, early enteral nutrition, when possible, use of agents and promote gastric emptiness, initiating of peripheral nutrition is situations in which enteral nutrition is not possible or tolerated, and use of enteral nutrition after extribution when oral feeding is not tolerated. According to these SPEN guidelines, enteral nutrition is preferred for patients in ICU who receive mechanical ventilation. However, the specific need of patient with COVID-19 may require the adoption of prone ventilation or neuromuscular blocking, and the consequently enteral nutrition implementation in daily practice would be difficult. On the other hand, the chances included by the disease itself in the gastrointestinal tract of the patients, along with the elevated sedation required for these patients, make it difficult to provide adequate nutritional support. On such consideration is related to gastrointestinal hypomotility that is commonly found in these patients within the high doses of sedation of opioids that are the needed to facilitate mechanical ventilation, since the other patient under similar condition do not present feeding tolerance. Moreover, despite several but similar to the less critically ill patient, energy requirement must be 20 to 30 kilocalories per day per kg body weight for polymorbid patient and patient with age more than 65 years, or for very severely underweight polymorbid patients respectively. Protein requirement should also be 1 gram per kg body weight in older people, and for those who are less than 65 years of age, it should be around 1.3 to 1.5 gram per kg body weight per day. Carbohydrate and fat, the fat should be 30% of total non-protein calories, and carbohydrate should be 70% of calories with sources of complex carbohydrates with no respiratory deficiencies, and in 50% with ventilated patients. Carbohydrates should be 2 gram per kg body weight per day, not exceeding from 150 grams per day. And the micronutrients, all vitamin, mineral, and trace element and water should be given according to the RD. Adverse effect of overdose of immunity booster food. Don't overdose on supplements. They can impact on your organs also. So don't overdose the supplement that they can impact on organs. Many herbs produce pose unexpected risks, and their ingredients have some strong effect on the body. Some have liver damage. Some herbs have effect on the acute liver injury. Prolonged consumption of kadha in wards of COVID-19 did lead to several severe acidity, acid reflux, heartburn, and bleeding from the stomach due to the gastric ulcer, piles, nausea, and vomiting. Consumption of hot water did bring patient to OPD with burns in the mouth and food pipe. Too much use of steam did damage the nasal mucosa and made people prone to sinus infections. Too much consumption of turmeric lead to diarrhea, headaches, and yellow stool. Too much tulsi consumption also lead to liver injury since it interacts with blood thinner. This is why it is not advisable to for the pregnant women. Excessive intake of vitamin pills over long period should also be avoided, especially those containing high doses of fat soluble vitamin A, B, K, that can lead to neurological problems, high calcium levels, and muscular weakness and liver damage, and irregular heartbeats and appetite loss and nerves damage. Selenium overdose also can cause brittle nails, hairs, nerves damage, and gastric upset. Zinc supplement take a long time can cause copper iron deficiency and causing anemia and decreasing in immunity. In fact, they can make you more prone to the infection. Excessive intake of vitamin C can create acidity, cause nausea and diarrhea, and interfere with the antioxidant pro-oxidant balance of the body. To avoid complications of excessive immunity booster, please talk to your doctor before using them. Also, read about the contents of your supplements, avoid unnecessarily prolonged usage, and follow a healthy lifestyle that is more imperative in build immunity. Take away messages: consuming nutritious food, eating more whole plants food, healthy fats, fermented foods rich in probiotic, limiting sugar intake, drinking adequate water, and managing your stress level along with regular exercise and getting enough sleep are the most important ways to boost your immunity system. Getting vaccination on time is the need of the hour. Don't skip your vaccination schedule for your children and elderly.
Thank you, Dr. Purnoor Siraj, for the presentation under the topic of dietary management, improving public health and awareness of overdose immunity booster food during pandemic. Thank you so much, Doctor. You can unshare your screen, and thanks for your valuable time, and also have a nice day.